The most important people in this presentation today are actually sitting behind me. What I'm going to present to you today is a type of wellness outreach program that is not run by the clinicians. It's actually run by the people with MS, both the people participating as mentors and mentees. This is a peer wellness outreach program concept that started off very small a number of years ago, funded by a very small grant from the Multiple Sclerosis Foundation, a very small program grant of $10,000. And we just started off very small, pairing up people with MS who had an interest in helping others with MS achieve better wellness. And there's a lot of detail behind that, but the bottom line is that that's how that program started off. And it's really grown organically into something very special. Instead of me introducing each of our panelists, I'm going to have them introduce themselves very quickly. The way this presentation will go is that I'll spend just about 10 minutes giving you the overview of the type of research that I do, and especially about this program. But the rest of the time is going to be their stories. And we presented this panel at the National MS Society regional meeting just down the way at the Raponi Center in Concord this fall. And it was the first program in that series I've ever attended. I've been going for about 10 years now. That participants asked for extra time. We had an hour session, and they said, "Can we extend this to 2 hours? We want to talk to these guys." They didn't really care about me. That's the scientists. Like, get out of the way. Let me talk to these guys. We're going to do the same thing here. So a little bit about the science, but then more so about what really matters to me. When you're a scientist or a clinician, at the end of the day, it's about the people. And that's what we're all here about today. So with no further ado, I'm going to pass the microphone to our panel, and then after I introduce the panel, I'll go into a brief introduction.
Okay, my name is Kathy Rhodes, and I'm from Ossipee, New Hampshire, way up in the White Mountains. And my participation in the program is that I'm a mentee, and so Bonnie down there would be my mentor to help me figure out what I could do to promote the wellness in my life. So I have a bigger story to tell, but right now I'll just be brief.
Hi, I'm Debbie Boucher, and I'm a mentee in the program also. My mentor is Andrea. I come from Manchester, New Hampshire, and I've used the program to go to a place called Project Walk, which has been an awesome experience.
Hi, my name is Bonnie Norton. I started the program probably 3 years ago as a mentee, and now I'm a mentor. I've been mentoring probably up to like 8 mentees now, and Kathy was one of my mentees. And so I benefited from the program, and I can help out now to share my knowledge of what a gift it is, and then to give to others. So, and I'm also from Londonderry, New Hampshire, so I kind of meet halfway with my mentees. And that was Andrea, and she had called us waiting for them. So I'll pass it to you.
Hi, my name's Amy Hall. I am the program manager for the study or for the group, and Brant loves to tell people that this is my favorite program that Brant does. I just enjoy working with all of these people, and it's so fun, and they're a lot of fun, and I'm very fortunate to be able to be part of it.
Thank you, everyone. When Andrea comes back, we'll introduce her. She has to take an urgent call. Let's do the quick introduction to this program. So I think you've already heard about this part. Can everybody in the back hear me okay? Is that coming through?
Yeah.
Okay, excellent. My mission as a scientist has been to improve MS care outcomes. There's a lot of different ways to do that. Some scientists focus on creating new drugs, new medicines. Others work on improving frontline clinical care. Others work on completely redesigning systems of care to get better outcomes and to give people more control over their own health care. My particular work has focused on the latter part, really empowering patients, redesigning healthcare systems to get better outcomes. And I'm going to focus on just one of those. The MS Improvement Collaborative is one of the studies that I've been working on. This is the first of its kind in the United States. Other illness conditions like cystic fibrosis and inflammatory bowel disease have done this. They pair together multiple sites from across the country that treat the same conditions. So in this case, we've got multiple sclerosis centers, many, all participating and contributing information to what we're learning. And the idea is to learn the very best practices and then disperse them across the collaborative and figure out what the best possible care approaches are for multiple sclerosis. So that's one body of work that's going on. The other is that in chronic illnesses like multiple sclerosis and others, there's often no one best treatment, and it can be a very confusing and complex situation for people when they're trying to choose a medication or a treatment that's best for them. There's an approach called shared decision making which can help. This is something called an option grid, which helps patients and providers talk about different treatment options. So we're actually developing those specifically for multiple sclerosis. The exciting part, though, for today is this program. This is an example of what's called a patient-facilitated network. In some of the new cutting-edge models, doing something called co-production, where the idea is that healthcare is not delivered but actually shared between patient and provider. Very different concept of healthcare delivery. In these patient-facilitated networks, the patients, rather than the providers, drive the bus and approach something, a different way of defining health. Rather, instead of defining it as an illness-based concept, we define it more in terms of a wellness-based approach. And wellness can be very different for many different people. So it's not about having the best hemoglobin A1C level you can have, or the best cholesterol level. It's about attaining the best wellness in your life, regardless of what illnesses you have. Whether you have diabetes or multiple sclerosis or inflammatory bowel disease, the science behind this is that you can maximize your wellness regardless of what medication you use. So the MS Wellness Outreach Program was designed for a number of reasons. In rural New Hampshire, there's a lot of barriers to access to services. Many of our patients drive more than 2 hours to get to us, many more than an hour. And we have wonderful wellness services here at the hospital, but many can't access them regularly. And so if you live in a rural or underserved area, if you're a long way from here at the hospital, oftentimes you can't access wellness activities like yoga, tai chi, or college classes. So we sought to mobilize the wellness effort. Instead of bringing people to us, we bring the wellness to them. And by using our grant funding to allow people in their local area to use that funding on local-based services, that was a key aspect of this program. The other aspect you're looking at right here, instead of professionals or clinicians delivering supports, the clinicians guided a team of peers, people who have MS themselves, who want to serve as mentors. Mentors and mentees then pair up and develop individual wellness plans for each of the mentors, and they pursue them together. And so if you think about your own life, and if you've ever tried to make a behavior change, tried to go on a diet or tried to exercise more, right? Easier to do it if there's somebody asking you about it. Hey, Brant, it's time to go to the gym today. Oh, I really don't feel like going to the gym today. You said you'd go to the gym today. Okay, I'll go. Or maybe we'll have a cup of coffee after the gym. So mentors and mentees engage in the wellness activities together. It sounds like a simple concept, right? Well, so is Alcoholics Anonymous, right? The most effective rehab approach for alcoholism. And that's that pair bond between the mentor and mentee that drives that progress. A severely powerful addiction, right? Alcoholism. But having that sponsor supporting someone who's trying to quit drinking is really a powerful thing. And so in designing this program, myself and others that engaged in this type of research thought, oh, can't we employ a model like this for wellness? And especially in a rural outreach situation, pair that with sending resources out to patients living there. So this program does that. We pair people with MS with a mentor who also has MS and is trained as a Concord Hospital volunteer and also in National MS Society and peer advisor. So they get some training and supported by an MS clinician. And then they go out and connect up with mentees, develop an individual wellness plan, and then that plan has to be reviewed and approved. Funding can only be used if there's financial need and if it's a wellness activity. So it's not replacing standard medical services or things that could be paid for by insurance. But it can pay for things like yoga classes or for a person who wanted to write again. We've got Dragon software, so they could actually do voice recognition. For another person, is being able to go and do work in a metal shop. For another, it was cooking classes. So wellness is broadly defined, and the idea there, is based on this idea in psychology that we call self-efficacy. If you have a central driver, a central motivation in your life, you're more likely to be able to self-manage your confidence. A lot of the tenets of this program are based on scientifically derived concepts established in research. But after we designed that framework, we then stepped back and allowed the mentors and the mentees to shape the program over time. Our grant funding has come so far from the Multiple Sclerosis Foundation. I would say that we're still a small grant-funded entity. We've received less than $100,000 in funding so far to date. I think our total funding has been about $60,000 so far. But with that funding, all of our staff and overhead is all volunteer. All the grant funding has gone directly to patients for their wellness activities. And this year we received an extra grant award from the MS Foundation to continue. Interestingly, I was just sharing with Deanne, this work has been invited for a presentation at an international conference in 2 weeks. I'll be traveling to Sweden to present on wellness outreach programs. They were so impressed with what the mentors and mentees have done in this program that they want to hear those stories. So it's definitely growing over time. Here's some examples of the individual wellness plans. We've had assistant dogs, Pilates classes, personal training, yoga, nutrition, hobby workshops, the dictation software, assistive devices that weren't covered by other approaches, and also programs like Power Walk. The key thing is that it has to be linked to the personal wellness plan. So it can't just be a random activity. It has to fit into the person's individual concept of what wellness is. We have been tracking our outcomes. This is not a formal research study, but these are opinion surveys that we track and for people in the program. Overall, contacts with peer mentors have been consistent and sustained. And people are completing their individual wellness plans. One of the potential problems with a program like this is if people don't do their wellness plan, it's not going to go anywhere. So we're finding that the peer mentors have been very effective in helping individuals complete their wellness plans. How often do you participate in activities? There's a few people who didn't remember what their wellness plan was after they completed it. But the majority are doing it 2 or more times a month, which is really good, especially when many people didn't even have a plan to start with or are not doing much at baseline. And do you feel that participating in the program has improved your overall wellness? Overall, very, very good. It looks like the numbers there didn't translate over. Cell range should have been a number there. 80%. Okay, good. But the bottom line, I think, I could put graphs out in front of you and numbers and statistical analyses. But the part that I think will matter most to you is hearing the stories. I'll share one before handing off to the group. I had followed a young woman with fairly severe multiple sclerosis for a number of years, and part of her symptoms was cognitive impairment. And this is a woman who had tried 3 times to complete a GED degree and had not completed her high school education. And she meets Bonnie in this program, and about 8 months later, she got her GED. Yeah, so when we think about what the potential of a program like this could be, it's beyond changes on MRI scan or beyond relapse rate reduction or medical outcomes. It's about a young woman having a chance to get a better job and have more mobility. And a volunteer did that, right? A very low cost program, right? And the cool thing is that this is how the mentors feel after they do it. And what we're finding is that people are signing up to be mentors. They're not getting the grant funding that it's going to the mentees, but there's such an intrinsic reward to being involved. And for many of the folks with MS who are not working full-time or not working at all, it's really an incredible experience for them to be able to guide others towards goals. So it seems like it's a type of program that is rewarding to all, and especially to Amy and I, because we just sit back in the staff meetings and let these guys drive, and it's amazing what they're coming up with. In many cases, and this is a characteristic of an effective facilitated network, people who live with the condition are better than the system in finding outcomes. In Kathy's story, which she'll talk about later, she wanted to find a power assist bike. We couldn't find her a bike that was through the system, that we could, that was affordable. Insurance couldn't cover it, other things couldn't cover it. And through the peer facilitated network, we actually found an affordable option that the grant could do. And it was because of people who knew people within this network, and many of whom who had lived with multiple sclerosis for a good portion of their life. So the reason why I put that out there is that we ended up actually saving money. If we think in terms of how the economics of healthcare works, if these peer facilitated volunteer networks can find people options that are effective for less cost, that's kind of a big deal. And the biggest deal is this. Kathy gets the bike now. She'll tell you more about her story. But this was a really big deal. This was something she really enjoyed, an activity she did with her friends and family, and including the younger generation. So at the end of the day, that's my measure of success for this program. So we're going to shift now to panel discussion. Some of the handouts you have, I think you have 3 handouts. There's a single-page description of the wellness program that a patient would see if they were handed this in clinic. There's a newspaper article from the Union Leader that came out in October about the program. And what was the third one? Oh, there's only 2. Okay. So only 2. That's even better. Less reading. Newspaper article and the 1-pager on the program. That'll be circulating while you listen to it. For the panel discussion, I'm going to invite first Andrina to introduce herself. And then for the panel, I may guide the discussion just a little. I'd like you to share your stories, but also to focus on the following questions. The first question is, what does wellness mean to you? How has the MS Outreach Program fostered facilitated wellness for you? How do you think peer mentors make a difference in wellness and population health for people with MS? What surprised you about the program? And what should potential donors know about the program? So I'll hand it off to the panel, beginning with Andrina.
Hi, Sorry, I'm Andrina first. I want to apologize for stepping out. I am a single mom, and that was my daughter's doctor. She hasn't been feeling well, so I apologize. I started in the program probably over a year ago now as a mentor. I kind of grew up with MS. I was diagnosed really young. I was 23, and MS was different then. I wasn't lucky enough to have people like Dr. Oliver and Dr. Cavett around when I got diagnosed. So I've wanted to be, I know how I felt when I got diagnosed, and it's been important to me to find newly diagnosed people and give them hope. Because when I got diagnosed, I felt like I was being told to go home and sit in a corner and do nothing. Unfortunately, at the time, they didn't know much then, and I was told to quit my job, which I never did. I worked full time. I took a vacation day, so I'm not skipping out. I was told I would never have children because I would be too tired. My daughter was born a year and 6 days after I was diagnosed. And I was told not to exercise because if I got too hot, it would be a problem. which I did have a little bit of problems, but I've earned my 2nd degree black belt in Muay Thai kickboxing. And at 42, I still compete in Brazilian Jiu-Jitsu. So I've always felt like the need to tell people it's not over. It's not the end of the world. Everybody has something, and we just need to find ways to work around that something. And one of my first mentees was a young girl. She was just starting college when she got diagnosed, and it was before I knew about the wellness program. And I had her come to my house, and we started working out and just, doing yoga and things that I knew helped me deal with fatigue. And we did that about a year, and then we joined the wellness program. And as part of me helping her, I convinced her to do the MS Mock Fest, which was to raise money and to help others like us and raise funds and awareness. In doing that was the first time she came out that she was going to help others. And she told people what she'd been going through for the past year, and it kind of empowered her and helped others at the same time. And we had been training and working out to do it, so all about the wellness. And part of this program, I was introduced to Deb, and Deb's been amazing. And her goal is to improve her gait, which MS is trying to steal from her, and she wants to do it without medication. So she's found on her own this amazing facility called Project Walk that is helping her meet her goals. And she's able to do that with funding through the grant. So we really appreciate everything.
Thank you. Thank you very much. No, please do. This is the good stuff. I didn't really talk a little bit about how much funding and how we do it. Every mentee gets up to $1,000. And some of that funding can support the mentor if they're going to activities. So say, for example, if a mentee wants to do yoga for the first time but is nervous about it, the mentor can get coverage to go with them to do it together. And the grant is directly invoiced, so patients don't have to pay out of pocket ahead of time.
As I said before, my name is Bonnie, and I was diagnosed probably about 6 years ago, but I think as many people with MS, when they're diagnosed, they figure I've probably had it for 30 years, and looking back, there was some symptoms long time ago, and when I first got diagnosed, I really got that deep depression, and I'm not me anymore, and who is this? I was always Miss Bonnie. I was the assistant director of a child care center, running around doing this and that, and discipline, and giving tours and everything, and then just over time, I could hardly stand up walking down the halls, and I had to go to part-time, and then finally I had to leave my job. And then I was talking to my neurologist, Ann Cabot, and I wasn't feeling at my top, at my best, and she told me about Brant's grant. We joked around about Brant's grant, and the things that I might be able to do to help out my spasticity and my strengthening my limbs and things. So then I was selected to be a participant of the grant, and I was paired with a mentor, and that was probably 3 years ago. And we met, and we had coffee and a nice conversation, and we met several times, and then I decided I wanted a gym membership. You know me, I have never had a gym membership in my whole life, but I knew this is something I wanted to try to get strong and be able to, at least I thought, if you don't use it, you lose it. So I just wanted to maintain what I had, and then I got some massages which helped with the muscle spasticity, and then after that I really was feeling good. I see Carolyn, my mentor, for different functions, and she'd say, "Wow, you're looking good." I said, "I'm feeling good." It was just such a positive feeling to be out there, because now my social emotional being was just boosted, and I had something to live for. I went out to the gym and I exercised, and I just overall, I think when anyone exercises, you feel good right there to begin with, and then seeing people at the gym and just talking and I don't know, I'm babbling, I'm sorry. So then after a year's time, I talked to Brant and I said I want to become a mentor. And since then, I think I'm on my 8th mentee, helping out with people find different wellness plans, and it could be from yoga to an assisted bike to there was other gym memberships, and there was so there was just many, and again I have MS and I still remember, but I just feel like I have a purpose now, and this has helped me not only physically but emotionally. I enjoy meeting up with these people and keeping in touch over the phone, emails, texting, and it's just volunteering has been really good for me, and I just will continue to do it as long as I'm asked to, I think, and I can't think of anything else. I'm sure I will after.
Check. I'll just add a quick comment about this idea of self-efficacy. A lot of the things that Bonnie was talking about fit into that term. And interestingly, self-efficacy has been linked to less hospitalizations, less use of medications, less needing of rehab services. And that all sounds good from a system perspective, but when you think about a person's life, if you don't have to take as many meds, you're not paying as much money out of pocket. You have less side effects. And you have more pride in what you're doing. And all that time you're not needing to engage with all these services and medications, you've got more time for your life. And so this idea of promoting this self-efficacy thing can turn into some very, would you say, tangible results.
Hi, I'm Debbie. I'm a mentee. I'm using the program to go to Project Walk. I was diagnosed with MS probably 20 years ago, and then shortly after that I got bitten by a tick, and I also got Lyme disease, which they're telling me at this point basically progressed the disease, because when I was first diagnosed I really didn't have many symptoms. The Lyme disease never was taken care of either, so now I have chronic Lyme along with MS, and over those 20 years it's just deteriorated me in a lot of ways. And last year I had to retire on disability. So this last year has been hard, but becoming a mentee in this program has been awesome. I've been trying to work out, and do things to help myself. And Project Walk was just, they really pushed me. I've been in physical therapy a lot over my life, pretty much constantly for different things. And I just never got what I've gotten out of Project Walk from physical therapy. I just don't think they focused enough on what my problem was, or they probably are good for general things, but when you have a chronic disease, I don't think they really are used to dealing with people with that. That's my thought. I don't know, but Project Walk is much more focused on people who have chronic illnesses, and they're and I don't know if anybody knows them. This woman, Victoria Arnold, she was just on Dancing with the Stars, and she basically was a paraplegic at one point in her life, and she can't feel from her waist down. And they helped her walk again, and her parents own this Project Walk because she went to one, I guess, that was in California, and there was nothing like that in this area, so they brought it here, and now they run it. It's a great organization. They really push you. That was another thing that I get from them, is that most of the people that I've come across, doctors, physical therapists, told me not to push myself with MS, that I would hurt myself. And talking to Andrina, you know, she was like, no, I pushed myself. She told me she used to exercise till she went blind, so that she knew that she was getting a good exercise, you know what I'm thinking? So I had to ask a lot of people when I went there, and they were saying, no, push yourself, do it. Because I had asked another physical therapist if I could go cross-country skiing, and he was like, oh, no, don't do that. This man that I'm seeing there said, yes, go. Do whatever you want to do. He said, it's good for you to push yourself. It's a good thing. And so he's got me into the frame of mind that I'm going to push myself, because and I do push myself, but I don't push myself as much as he pushes me. When I go there, I pay for a day or two, but I feel like I'm gaining strength, for one thing, and stability. It doesn't take me as long to recover from exercising, stamina. So it's been a great experience, and I've met Andrina, who's become a great friend. And we have so many similarities in our disease. It's great to talk to somebody in my shoes, because doctors are wonderful, but they don't have time, and they also, everybody's so different. They just can't possibly know all of the things that might be something that would help you, or when you tell them that you have this particular problem, they might not know or have heard of it, so they just don't really know what to do with you. But when you talk to somebody who's in the same boat as you and has had that problem, they can offer you suggestions as to how to help yourself. So it's been a wonderful program.
Project Walk doesn't take insurance at the
Right.
state, so because of this program,
They've been paying for you to go. Which, and hopefully they're looking to be covered by insurance, so hopefully they will, because I will run out of money. But I feel like he's given me enough to go with, that even if when it has to end, I'll be okay.
Thank you very much for that excellent story. I'll make two quick comments. One is that it's now known in MS and other chronic diseases that more exercise equals less fatigue. And some of what is informed us has been the experiences of our patients. That's one of the strengths of what this patient-facilitated network is. We're learning and experiencing together. And that can also have policy implications. Say, for example, the Project Walk really is something that we decide to advocate for on a policy line. You know, we can bring this network to bear to push for insurance.
I asked.
Yeah.
Certain insurances are hard. I think they're covered by state now, but mine.
One of my mentors, I did my graduate training at Dartmouth. One of my mentors was an improvement, Paul, and he often said that every system is perfectly designed to get the results it gets, and everybody's trying to do a good job. They just don't always know what job they're doing. Right? And so when we think about being a clinician myself, it would be humbling to hear that we don't always have the right answer. But I would argue that if we engage patient-facilitated networks, we can get closer to the right answer. Because many times the patients themselves have the right answer. In your case, you found an answer that worked for you. We just needed to find a way to facilitate it. The other thing that might come up is like, well, how do you make sure that you don't engage in something that isn't going to be helpful that might be harmless? We have monthly staff meetings, which I attend, and other clinicians can participate as well, to provide some feedback as we talk about these different qualities before we approve them. Like, for example, if someone recommended bee-sting therapy, we probably wouldn't recommend that because we know it makes MS worse. So we do have that consultative mechanism to make sure we don't do any harm. But at the same time, we have a very open mind to things that might use.
Hi, excuse me. So my name is Kathy, and I live up in Ossipee in the mountains. And I was diagnosed with MS in 1996. And of course, it devastated my life at the moment. the diagnosis, and I was a nurse at the time. So I just thought, well, you know, I don't know, I guess I'll just go for it. Well, to make a long story short, because MS is a progressive neurological degenerative disease, it eventually took its toll, and I had to go on to disability in 2005. And it's a really great brochure that the MS Society puts out that says, but you look so good. But all of these subtle, I mean, they're not subtle for the person that has MS, right, is that you have a tendency to get depressed, which is a well-defined symptom of MS. And also you don't have the stamina that you used to have. And then I couldn't multitask any longer. So maybe I wasn't actually needing a wheelchair, but I was fighting all of these symptoms. And it was progressing in my cognition. I would get overwhelmed and couldn't do the bills as easily. And then I began to see Brant and for the depression and those feelings of cognitive overwhelm, feeling overwhelmed. And he said to me at the time, I think you would be a really good candidate for this wellness program, because I had always been pretty physical and hiking, and I just couldn't do that anymore. And so I said, all right, well, what's that about? And then he told me briefly the program, and so I was assigned, thankfully, to Bonnie. And Bonnie and I met at Panera Bread, and I told her my story about I was going on a bike trip every year with my very, very, very good friends to Martha's Vineyard. And we've done it for 30 years, and such great friendships we've developed. But as my MS progressed, I could no longer ride my bike, so because of my balance. So I said, well, I think maybe what I'll do is just get a three-wheeler. So I rented a three-wheel bike from Northeast Passages out of UNH there, which is a great program. And I brought it on my bike trip, and I was all excited, but then my stamina was now challenged. And so I'm riding my three-wheel bike, and I can't make it up even the slightest hill. So I got pretty discouraged about that, and then I said, all right, but that's all right, I'll figure it out. So when I went home, I said, I'm going to get a bike that's not only three-wheel, but it's a battery-operated bike. And oh my gosh, they were so expensive. They were like $2,000 or more. So I told this story to Bonnie at Panera Bread, and she said, she picked right up on it, and she said, you need a bike. That's what you need. I'm like, okay. So yeah, so she brought her laptop to Panera Bread, and we researched all of these bikes, and they were pretty expensive. And so we went home, each of us, knowing some idea, but she would call me, which is really the whole success to this program. She would call me and say, so how you doing, Kathy? And being a procrastinator that I am, oh, good. Well, what sites have you been on to look for it? And so I would tell her, and then I couldn't find one. So anyway, she found a company that had the bike that was three wheels, battery assisted, with a basket on the back for $1,000, which this program, yay, Bonnie!
I had a mission.
Yeah, she was on a mission. And so it got delivered to my house in a box with a lot of screws and everything. And so my two sons came over, they live in Concord and Manchester, and they opened the box on the living room floor, and they put the whole bike together for me, which was an awesome experience to have them, for them too, to be feeling like they're helping their mom do something really successful. And so that year, I went on the bike trip, and the really nice feature of this bike is that you activate the battery only when you need it. Therefore, when you're riding your bike, you're getting lots of exercise, but then as you come to a hill or something, which is where my stamina never lasted, I would be able to go up. And my friends are like, we want one of those bikes. Had a big basket on the back. And then I think you saw up there the picture of me with my grandchildren in the basket. My mother would have a block party at the 4th of July every year. And they all went around the block in their costumes, and I could never do it. It was about 1.5 miles. And then this makes me emotional because my grandchildren came over and said, Nana, are you going to come with us? And I said, well, it's a long walk. And they said, well, why don't you use your bike and we can go in the basket? So the two of them sat in the basket, and I went all around the block, and now I can go on my bike trip. But the thing that made this so successful was Bonnie's support, because it's the human connection that happens. I mean, I could get $1,000 maybe from some place that would, support that. Yeah. But to have that connection with Bonnie, and we both have MS, and she knew exactly, she's really gifted at this. She honed right in on what would be good. And what it's done too for me is it's got me out of the house. Now that there's snow, I can't obviously ride that bike, but it motivated me to take the clothes off the exercise bike at home, the stationary one, and now I'll ride that through the winter so that it will motivate me to be strong enough to ride that other bike when the nice weather comes. And I can't even say how much this program has meant to me, because it really, just to get us together. When you live in Ossipee in the woods, there's not a what do you call those places you go to? A gym. There's no gyms nearby. Yeah, see how I don't even know what they are. And even I'm 3/4 of a mile to my mailbox at the end of my road, and the kids now want to go get the mail with me, so they get in the back of the basket and everything. And like Brant said, there is a well documented and researched how much exercise helps MS, makes you stronger, and the human connection, obviously. I mean, any of us, I'm 63 now, so I was starting to feel like I would just stay in the living room and do the exercise on TV, which I could have done, and I did it once. But the connection of a person through this program, it can only make it so successful, because it's awesome to have Bonnie and all of us have all grouped together and everything. So that's my story, and I'm sticking to it. Yeah.
Thank you for all these stories, and I don't know how much more time we have, but we can continue for as long as we like. I noticed two really interesting things watching this. My role in this is to facilitate the support while they develop the program. They run the staff meetings, they lead the program. And when things like coming up with, let's find a bike for Kathy, the whole group goes at it. And other mentors chime in. They say, you know what, check out this resource, or look into that resource. I'm going to check into this for you. And the best that we could do at the system level was twice as much as what we could find with this support here. And it's just, when my wife asked me whether I had a good day at work after coming to a staff meeting with this group, the answer is yes. They really have come together as a group to be very effective. The other thing I've noticed is I'm a mental health practitioner within the MS clinic here, and the people that go into this program don't have to come back to see me. That's a very interesting outcome. And when we think about the fact that most of the time we're prescribing medications and doing counseling, and that's very important work too. But imagine if we wouldn't have to do that, and people wouldn't have to feel what depression feels like with approaches like this. So that kind of makes you feel.
And if you notice, most of I can talk loud enough, I'm sorry. Can you hear me? Most of our stories started out, I think, with the word depression and, how I felt because someone said I couldn't do that. And then I think this took away a lot of this and just boosted us all up. And I'm not depressed. Sorry, Brant. I love that.
There are times when I'm happy not to see you. But in a good way, right? Because if people don't have to come in to see me for depression, they're feeling better. They're doing better. And that's the goal. We want people feeling well. And certainly, we're here today to share that story. There's many programs of this type across the country that are finding success. This is one of the few that I know of this kind for multiple sclerosis, especially in this area. So we're looking to expand the program. We need more funding support to do that. But certainly, at the level we're funded right now, we'll be able to expand it modestly, and we'll continue to do that. Our hope is that our mentees will become mentors, and that will help us to continue to scale the program. And so far, that's what we're seeing. In terms of, go ahead.
Yeah, can you share with the group how many mentors and mentees you have or have had since the project began?
Sure. And if you think about the total funding we've received, it's $1,000 per mentee. So it gives you a sense we've had less than that amount of our mentors and mentees. But I think we're somewhere along the line now of over 23, 24 people who participated in the program. So we're still pretty small scale, but if you think that we started off with 3, it is expanded, especially given the fact that everybody here is, and myself included, is all participating volunteer. Every cent of what we bring in goes to the benefits for the people participating as mentees.
What would you do with additional funding? Do you expand this program, or do you have other?
Sure. The question was, what would we do with additional funding? First and foremost, we would scale it. We have more people than we can accommodate. So that'd be goal number 1. But goal number 2 is that National MS Society is interested in funding with larger dollars if we can show pilot data. So additional funding would help us get the pilot data to get the big grant that would maybe take this, regional or national. So I think that would be nice.
I understand that the program really works with the person-to-person connection. Do you see that ever working on a virtual basis? I'm just thinking my mom's in Florida. I know she doesn't have access to a program like this, but I think in some ways, even if it's on a video chat or phone, texting, emailing, do you think that would be helpful?
I actually work remotely for a company in Ohio. So just in terms, I think you can connect with people virtually because you still have that face-to-face. So I know that I'm able to connect with people virtually, and I've done a lot of, I like to do yoga, but my balance was off a lot. I don't like to fall in public. It's just not my thing, and I don't have peripheral vision, so group classes can be challenging for me. So I did a lot of workouts myself at home. I used Beachbody. But I wasn't successful at it until I joined the Facebook group where I could actually have accountability. So I see that this program could absolutely work virtually because it's more of the, hey, did you work out? I didn't see you post today. What's going on? Did you go for that walk? I'm in other groups online. I was taking a medication for my MS, and it was fairly new when I started. And a patient had started a Facebook group, and has anyone experienced this? So I see a lot, and I mean the world is changing. I have a teenager, and social media is huge, but I definitely think this type of program and this model could work. I think it's more connection can be anything. We could be sitting face to face, but when her and I text, I think our connection is just as strong. I don't know if you feel the same way. Like it's even as simple as, hey, how'd it go today? I'm thinking of you today. And then when she texts me, hey, I know I'm like, oh, I'm so excited you had a good day. You're feeling good and you're feeling strong. So I still get the same emotion. Thank you.
Comment to that. One of the things I glossed over early on was the MS Continuous Quality Improvement Collaborative, that first multi-center effort in the United States for MS. Our goal is to replicate what cystic fibrosis They have 110 centers throughout the U.S. And you imagine with that kind of network, you could pair a tech option with your suggestion with local presence. So you could be talking to your mentor in Boston, live in Florida, and then you have your resources available right next door to where you live. We might be able to mobilize something like that for a number of years.
So being virtual, one of the things that I thought was really cool about it is that my husband videotaped me coming down the driveway and doing all these things and going to the mailbox and so now it's on video. And so my friend's, my daughter-in-law's father called me and he said, my cousin just got diagnosed with MS and would you be willing to talk to her? And so I did, and I called her, and then I told her about this program. And then I showed her the video, of course, online, attached to our email, and she was just felt so much better, like her spirits and everything lifted up, just to see such a successful program. And one last point I wanted to make is that when you go on the National MS Society walks and everything, they're awesome, and the MS Society is awesome. But what's really unique about this program is that it's locally, I don't want to use the word local, I want to use the word, no, it's living day to day, on making your life better. I mean, well, the MS Society obviously is looking for a cure, but that probably won't be in my lifetime, and what's that? Oh, it did? Oh, all right. So my point about that is I could wait for a cure or I could live my life every day now going forward. And this program helps bring quality to the life of people that are living with a chronic illness. So it's an awesome thing.
I think it's you meet your original goal or find your wellness plan with your mentor, but then it builds. We have a connection. We still, I mean, when did we started 2 years ago, but we're still in contact. And I know. The bad headache just keeps showing up. And then
There are side effects.
some say good, some say bad. Yeah. But he was saying with another one of my mentees, the GED. I mean, when he said it again, I got goosebumps, and to have that connection with her, and knowing that Brant had told me she might be a little tough one, but she texted me this morning and asked me if she could use me for a reference on a job application. I'm like, yeah. And it just, we met for lunch to celebrate. I said, you get your GED, my treat. We have a good connection, and this is all through texting, email, phone calls, face-to-face, all of it. And it's just keeping the connections, just not that, here's your gym membership, see you later. It's that bond, it's that, the mentoring, sticking with. I don't get benefits, I didn't get benefits just from being a mentee. It lives on, being a mentor. I think I get more from being a mentor. I have, like I said, I have 8 people that I've connected with, and one in which wants to be a mentee now. And another one, after she finishes her wellness plan, I think she wants to be one too. And it's just, it's so rewarding, and it's socially exciting. It's done a lot for me emotionally. Like I said, I can't say how this program has done a lot for me and all of us, I think, in different ways, many different ways.
When I hired Amy, she had to step out. We've been asked by the National Quality Forum, which is funded by Centers for Medicare and Medicaid, to study a new quality outcome measure in multiple sclerosis. She had to take that call. I didn't want to leave. When you think about what makes makes your day, this is what makes your day. When I hired Amy to do the national studies, that study's okay, but this one, I really like this one. And so she is actually doing this program volunteer as well. It's just a very inspiring group. And they often say, oh, Dr. Oliver, what a great program you designed. I really can't take credit for this program. You know, I might have facilitated and got the initial grant funding, used some science to frame it, but its heart and soul is in the people. They drive the bus. And there's a growing thinking in healthcare that they can advise the healthcare system in the future. This in a very small scale is doing that. So I imagine we're at time, or do we have a little more time?
Do we have any more? We'll take one more question. Do we have any questions?
I was just gonna thank you all for your time. You were wonderful for you to share. It's not always easy to share your story with strangers, and we definitely appreciate it. All very touching. And I've heard you here the whole hour.